सीनियर सिटीजन है, लेकिन छोटे छोटे हमारे पोता पोती है, उनको भी दिक्कत हो रहा है स्कूल जाने में। सांस फूलता है, मेरा खुद ही सांस फूल रहा है, आँख में जलन, नाक में जलन, गला में एकदम पूरा चुपचुपाहट हो रहा है, हालत है।
काफ़ी दिक्कत हो रही है, बहुत बीमारियां भी लग रही हैं लोगों को प्रदूषण की वजह से।
बहुत पोल्यूशन हो रहा है और मॉर्निंग में तो बहुत ही ज़्यादा होता है। मॉर्निंग में तो निकलना ही मुश्किल हो गया है, बिना मास्क के निकलना तो बहुत मुश्किल है।
स्मोक की वजह से काफ़ी ज़्यादा बीमारी फैल रही है, जिसकी वजह से सांस की प्रॉब्लम है और बहुत ज़्यादा लोग बीमार हो रहे हैं।
स्मोक की वजह से 1,20,00,000 बच्चे स्कूल नहीं जा सकते। बच्चों का मैं कह रहा हूँ पाकिस्तान तबाह हो जाएगा अगर ये स्मोक रही ना। इनको पता है अब ये ट्रैफिक का ये हाल है कि ट्रैफिक बेपन है।
Schools shut, vehicle movements restricted, construction banned, and masks, a pandemic relic, are back, but this time to battle a different enemy: air pollution. This is New Delhi, the capital of India, engulfed in toxic haze, now an annual story told yet again. Delhi's air quality has skyrocketed to hazardous levels, threatening the health and even the lives of its residents.
The huge amount of construction work going on, which is creating a huge amount of dust. There are multiple cases of garbage and landfill burning, which is adding to a lot of secondary as well as primary particulate matter into the air. And last but not the least, there is a huge amount of e-commerce which is pushing a lot of freight vehicles into the city. Although we now have the Eastern Peripheral Way, even then there are a lot of vehicles which are coming into the city and they're freight trucks. So obviously there is a very high pollution source because of this.
The air quality index has breached the severe category, with readings consistently above 400. The phenomenon is not new. Over the last few years, Delhi and its surrounding areas have been subject to poisonous air that's become a regular with the onset of winters. Vehicular emissions, industrial smoke, and construction dust contribute heavily. While human activities play a big role, Delhi's landlocked geographical location also worsens its air. Winds from the west, including those coming from the Thar Desert and agricultural regions of Punjab and Haryana, carry dust and smoke into Delhi. Each winter, there is one activity that is called out the most. Parali, or crop residue burnt on the fields of Punjab, Haryana and western Uttar Pradesh around the capital, is often blamed for turning the capital into a gas chamber. As the window for the Rabi crop, particularly wheat sown in winter, is very small after the paddy harvest, some farmers set their fields on fire to quickly clear the crop residue to prepare the fields for the next sowing season. The smoke that arises carries a large quantity of toxic particulate matter called PM2.5 because of its size, 2.5 microns. Potentially lethal gases including carbon monoxide, methane, and volatile organic compounds disperse into the surroundings. Eventually, they combine with the cold winter air and form a thick blanket of smog. PM2.5 refers to inhalable particulate matter with a diameter that is generally 2.5 micrometers and smaller. These particles are so small that they can bypass our body's natural defenses, traveling deep into the lungs and even entering the bloodstream. Prolonged exposure to PM2.5 can cause severe respiratory issues and heart disease. A study by the Global Burden of Disease estimates that over 2 million deaths in India every year are linked to air pollution, with PM2.5 being a major contributor.
गले में सारा सबका गला खराब हो रखा है.
Everyone has a sore throat or fever because of this pollution. The government should ban crop residue burning. All the smoke not fog. It's just smoke everywhere. The government should stop crop burning.
इनको रोकना चाहिए सरकार को कि उनको वहाँ पे पराली ना जलाए.
This is Sanjay Goyal. Like many other residents, he is blaming the crop stubble burning for his present condition. In the northern Indian state of Punjab, 1,251 fresh farm fire cases were reported on the 18th of November, according to the Punjab Remote Sensing Centre. This was the single-day highest this season, taking the state's total count of such instances to 9,655 this season. Here's a sense of what's going on. Muktasar district reported 247 stubble burning incidents, the most in the state, followed by Moga 149, Firozpur 130, Bathinda 129, Fazilka 94 and Faridkot 88. Between September and November, there were 48,489 fires lit in Punjab in 2022 and 33,719 in 2023, which means a significant drop in the last 2 years.
We need to remember that sources such as stubble burning, etc., which people have been talking about, they actually do not contribute more than 40% in a 3-month period. Or if we look at specifically that particular period when it is at the highest level and the contributions in terms of weather favoring it to come to Delhi is on the peak, I think it is maximum at that. But if you are looking at the entire quarter or entire period of winter, it actually is as low as 10%. So even if we look at the higher number of 40% during the peak seasons, we need to ask ourselves what is the rest of the 60%. So the rest of the 60% is our own problems.
Despite government bans and other interventions, stubble burning remains widespread and its effects are there for all to see. The burning coincides with cooler temperatures, which trap the smoke in the air. The smoke is then blown into cities. Emissions from vehicles, industry gases and other effluents add to it, creating a deadly concoction. A study by the Centre for Science and Environment reveals that between October 12th and November 3rd, 2024, vehicular emissions was the top contributor to air pollution in Delhi, accounting for 51.5% of the city's pollution. Neighbouring districts to the capital added 34.97%. Farm fires contribute 8.19%, and dust particles make up 3.7% of the total air pollution in the city. Air pollution is a crisis that is choking cities across the globe. But what exactly is air pollution? How does smog form? Why is it so deadly? And what is air quality index? Air pollution happens when harmful substances like gases, chemicals or particles contaminate the air. Air quality is also linked to the Earth's climate and ecosystems globally. Many of the drivers of air pollution are also sources of greenhouse gas emissions. Smog is a term combining smoke and fog. It is a visible form of air pollution. It forms when sunlight reacts with pollutants like nitrogen oxide and volatile organic compounds. Smog is more than just an eyesore, it's a health hazard. Breathing in smog-filled air can cause respiratory problems, aggravate asthma, and even lead to long-term cardiovascular issues.
I feel irritation in my eyes. My eyes are burning and I will have to wash my eyes. Secondly, I am finding it difficult to breathe.
Air Quality Index, or AQI, is a numerical reading used to measure and communicate air quality levels. It provides a simple way to understand how polluted the air is and its potential health effects. There are 6 categories of Air Quality Index: good, satisfactory, moderately polluted, poor, very poor, and severe. Severely declining air quality has led to many comparing the situation to smoking. According to AQI.in, the national capital's air quality index as of 12:30 p.m. on November 18th stood at 978. This is equal to smoking more than 49 cigarettes every day. Experts say in these conditions, there is no difference between smokers and non-smokers.
I specialize in lung cancer treatment. When I look at my 30 years career, 30 years back, most of my lung cancer patients, 95% plus, were known smokers. One, they were in 50s and 60s mostly, very few women, and this was the overall scenario. These days, number one, we are seeing more. So every OPD, when I sit today, and I look at the lung cancer as a percentage of my total patients, it's much higher today than it was 30 years back. So we are seeing more lung cancer. Number two, the difference between smoker and non-smoker is gone. 50-50 is the current distribution. So a so-called smoker and a so-called non-smoker, according to my data, and it is also corroborated by other cancer centers, it's an equal distribution, which is a very, very alarming change in a short span of 30 years that I've seen, and I attribute it to air pollution.
To curb the worsening air quality in Delhi, the Commission for Air Quality Management, or CAQM, implemented Stage 4 of the Graded Action Plan, or GRAP, from 18th November. When the air quality deteriorates to a particular point, GRAP is put into place as an emergency solution. It categorizes pollution levels into 4 stages, with each stage triggering specific actions aimed at reducing pollution. Stage 1 is poor with an AQI range of 201 to 300. Stage 2 is very poor with an AQI of 300 to 400. Stage 3 is severe, AQI 400 to 450. And Stage 4 is severe plus, with the AQI exceeding 450. Under Stage 4 of GRAP, strict measures are implemented when air quality falls into the severe plus category. Entry of all trucks into the capital is stopped, except for those carrying essential goods or operating on CNG, LNG or electric fuel. All diesel-operated medium and heavy goods vehicles registered in Delhi are banned unless they're transporting essential commodities or services. All construction and demolition activities, including work on public infrastructure projects like highways, roads, flyovers and pipelines, are halted. School authorities may switch physical classes for students in grades 6 to 9 and 11 to an online format, and decisions about closing higher education institutions may also be made. Both government and private offices are instructed to allow 50% of their employees to work from home. Air pollution is a major environmental health problem affecting people in low, middle and high-income countries. According to the World Health Organization, ambient or outdoor air pollution in both cities and rural areas was estimated to cause 4.2 million premature deaths worldwide per year in 2019. This mortality is due to exposure to fine particulate matter, which causes cardiovascular and respiratory disease and cancers. Respiratory illnesses in Delhi are surging, with a significant rise in the number of hospital admissions linked to toxic air and even deaths. Deaths due to respiratory diseases in the city have more than doubled in 18 years. In 2005, respiratory diseases accounted for 4.91% of all institutional deaths. By 2023, air pollution in Delhi contributed to nearly 9,000 deaths, with a 9.93% rise in fatalities linked to respiratory diseases like pneumonia, asthma, chronic obstructive pulmonary disease, commonly known as COPD, bronchitis, and other acute infections. Doctors warn that pollution is aggravating pre-existing conditions and triggering new health issues, especially in vulnerable groups like children, the elderly, and those with chronic illnesses. The surge in respiratory cases have strained hospitals, with many reporting a significant rise in admissions, particularly during winter months when pollution levels are at their highest.
The air quality is actually so bad that the effects start from your skin. So there is kind of itching, all kinds of skin problems are occurring, burning eyes, burning in the nose, congested sore throat, difficulty in breathing, even to normal people, worsening of the difficulty in breathing in those who are already known asthmatics, occurrence of breathing problems, worsening of pneumonias in people who have COPD and other problems, known increase in admissions because of pneumonias, because of heart attacks, because of brain attacks. So there is a long list of problems which we all have recorded to occur with a much higher frequency post these most polluted days compared to similar days in rest of the year.
Medical experts note that the situation is made worse by factors like antibiotic resistance and increased frequency of infections, which are both linked to prolonged exposure to toxic air. Clean air, which is a fundamental human right, is now taking a heavy toll on people's finances. Medical costs associated with respiratory issues, ranging from mild conditions like common cold and cough to more severe diseases like lung cancer, are staggering. On average, the cost of a doctor's visit for a routine cold or cough caused by air pollution can cost you somewhere between 500 rupees to 3,000 rupees, or between $6 to $35, excluding medication. For more serious conditions like asthma, COPD, or lung cancer, the daily medical expenses can be even more overwhelming. A lung transplant can cost you up to 2 crore rupees, or over $236,000. But how can one improve the situation? Many people opt for air purifiers for better air quality, but is it really effective? The cost of an air purifier in India can range from 5,000 rupees or $60 and can go up to $1,000. While air purifiers can certainly improve indoor air quality, this might not be a complete solution.
For a long time, we thought that air pollution perhaps causes only respiratory problems, okay? If you're asthmatic, if you have COPD, you'll be affected. But now the new science has established very clearly that air pollution hits and affects each and every organ of our body. And the fact that the pollution levels are so high that only small incremental steps cannot help. You really need leapfrog solution. Purify the air, you need to shut down everything. You just have to confine the air. You can't open your windows, you cannot open your doors, and therefore you purify. But a longer use of that will also be unhealthy, because then you are losing access to oxygen. The CO2 levels are increasing inside.
Experts stress that long-term solutions to Delhi's pollution crisis must focus on broader measures. That includes regulations on industrial emissions, better waste management practices, improvements to public transportation systems to reduce vehicular emissions, one of which is Odd and Even scheme. The scheme came to light in Delhi in 2016, a copy of the plan instituted in the United States in 1979. This rule allows cars with only odd or only even number plates to ply on a particular day. To simplify, if your car carries an odd number registration plate, you will only be allowed to drive it on an odd day, and vice versa for even days. But the result didn't help improve the overall air quality. Despite temporary measures, the pollution levels in Delhi are unlikely to improve unless long-term interventions are implemented. Without such action, respiratory diseases will continue to increase. Air pollution not only affects public health but also harms the economy. In 2019, the World Bank estimated that air pollution caused economic losses of $36.8 billion or 1.36% of India's GDP due to premature deaths and illnesses impacting labor productivity and health costs. The implementation of Stage 4 of the Graded Response Action Plan GRAP in India's capital has significantly disrupted the trade sector, with business losses estimated at 20%. Popular areas like Khan Market are seeing up to 60% drop in sales. Business around the wedding industry has declined as much as 50%, restaurants by 20%, and the retail sector by 15%. This widespread disruption highlights the severe economic toll of air pollution, affecting both local businesses and national growth. As the air crisis intensifies, the implementation of long-term measures has become imperative. One approach that has garnered attention recently is cloud seeding, a technique used to induce rainfall artificially. Cloud seeding, or weather modification, is an artificial way to induce moisture in the clouds to cause rainfall. It can work only if there are suitable rain-bearing clouds in the region. Rainmakers spray salt powder and a mixture of calcium chloride and calcium oxide into clouds, carrying humidity to make them bigger. Ice is also sprayed beneath the clouds to help it rain faster. Pakistan, which is facing its own air quality crisis, turned to this method to try and clear the haze from its cities. Even Haryana's Gurugram recently experimented with this method to combat pollution. Although the rain was artificially created using sprinklers, the effectiveness of cloud seeding remains debatable. While it can reduce pollution levels temporarily, it is not a sustainable or cost-effective solution in the long run. Air pollution is a global issue. It does not recognize national boundaries. Around the world, air pollution kills 13 people every minute, many of them in cities. This problem could widen as urbanization accelerates. Countries must share technologies, resources, and best practices to tackle this issue. Cleaner transport, energy-efficient homes, and better municipal waste management would reduce key sources of outdoor air pollution. Climate diplomacy can also play a key role. Through international cooperation, countries can offer innovative solutions. But the bigger question is, with all the blame game around it every year, how can the plan be implemented on the ground? The fact is, temporary measures will not address the bigger issue. One needs a permanent solution. Fighting pollution must be a year-round exercise rather than just waiting for winters. With air pollution levels soaring to new heights, people have been pushed to breaking point. The air emergency is for real, and genuine work towards fixing it is long overdue.